Hello, I'm Dr.Parinaaz Parhar, and today I'm going to try and answer one of the most commonly asked questions in the OPD. Doctor, how much is an IVF treatment going to cost us? Well, I wish I had a very simple answer for this, but I'll try to simplify it as much as possible. What we need to understand is that IVF is a very individualized treatment protocol. It's not something like one size fits all. We have to actually decide your treatment protocol based on your past history, based on what treatment you've had in the past. And that's why the cost of the treatment tends to vary so much from one patient to the other. While for some patients, the treatment might cost as less as less than 1.5 lakh Indian national rupees, for others, the cost may cross about 3 lakhs or more. Why this huge difference in the cost of the same treatment? Well, that's because it depends on what dose of injections were required. Now, the dose of the injections is basically determined by the age of the patient, what is the ovarian reserve of the patient, and also by the weight of the patient. So if you're someone who is thin, who is young, and someone who has a good ovarian reserve, such patients usually require lower dose of injections. Whereas patients who are elderly, who have less number of eggs, as well as patients who are on the heavier side, they will need a higher dose of injections. Now, when we look at the cost of the IVF treatment, the most variable component here is the injections. So that's where mostly the difference in cost arises. So patients who are thin, young, and who have more number of eggs, usually their treatment will be cheaper, it will cost less. Patients who have less eggs, who are elderly, as well as those who have less number of eggs, usually they need a higher dose of injections, and that's why their treatment tends to cost more. Also, if you're someone who needs a prolonged duration of injections, the cost of the treatment will tend to increase. Now, another cost variable which we tend to see is if you have any added cost, if you have a cause of male infertility contributing to the infertility in general. So if there are some added interventions which are required for the male partner, like besides the IVF and ICSI, suppose if the male partner needs a teaser where you need to remove the sperms directly from the testes, or if you need to add some sperm selection factor in order to reduce the DFI of the patient, these are added costs which might increase the cost of your treatment. At times you have patients who have had previous failures in the past, and you need to do added interventions in order to try and improve the success rate. These can be procedures like PGTA, which involve the biopsy of the embryo, as well as procedures like ERA, which involves the biopsy of the endometrium. All these extra interventions tend to increase the cost of the treatment, but mind you, they are important because they will help in improving your chances of conceiving also. Another thing which might increase the cost of the treatment cycle for a patient is whether the doctor does a fresh or a frozen embryo transfer cycle. A fresh cycle is where your transfer is done in the very cycle where your egg retrieval was done. And the frozen embryo transfer cycle is where the transfer is done in a subsequent cycle. Nowadays, most of the clinics worldwide are resorting to frozen embryo transfer. It tends to be slightly more expensive, marginally more expensive, because it has an extra procedure of freezing of the embryos, then thawing of the embryos in the next cycle. So it tends to increase the cost marginally, but it is usually resorted to because it tends to improve your success rate. So if to put a figure to the question of how much will your IVF cycle cost, it can cost to as less as under 1.5 lakh rupees to as much as maybe about 3.5 or more, depending upon the kind of patient, depending on the cause of infertility, depending on the stimulation protocol, and depending on the complexity of the case.